Hi everyone, my name is Dr. Jordyn Newman. I'm a chiropractor at Total Body Health. Little background before we get into the talk today. I went to the University of Victoria and studied kinesiology, and I played basketball for the Vikes. And then once I graduated, I traveled and then worked as a kin a little bit and decided I wanted to go back to school to be able to help my patients a little bit more. And then I went to the University of Western States in Portland, Oregon, and did my doctorate of chiropractic there. So today we're going to be talking about headaches, why we get them, and what to do about them. So the global burden of disease in 2022 has highlighted that headaches disorders as being the second leading cause of disability and first among women under the age of 50. And each day, approximately 15% of the world's population has a headache, with 52% suffering from an active headache disorder each year. So there are many different types of headaches, and it's really important to figure out what type of headache you have going on because there's different causes. So it's when you come in and we're looking at the headache symptoms that you have, talking about everything, the symptoms, where you feel it, that helps to paint a picture, and it's going to give us the best opportunity to treat your headache going forward. So there's two different types of headaches, usually primary and then secondary. So primary headaches are when the headache is the main problem and the pain is associated with inflammation of pain-sensitive areas in the body in and around the head and the neck. So that could be nerves, blood vessels, or muscles. And it's up to us in the office here to determine what is causing your headaches with that. Secondary headaches, I'm not going to talk too much about them today, but I just wanted to highlight a little bit on them. They're usually secondary to a disease process that's triggered, that triggers the pain-sensitive areas in the head and the neck. They're rare but can be more serious than primary headaches, and usually a warning sign that there's some sort of underlying condition. And usually one thing is it can present as excruciating and the worst headache you've ever had. So if you do have something like that, definitely go seek help. Okay, so the three common primary headaches are attention type, migraine, and cervicogenic. And I just wanted to take note here that cervical generated headaches account for about 15 to 20% of all chronic and recurrent headaches. So the first one is attention type headache. The two main causes for attention type headache are going to be stress and usually dehydration. And where you're going to feel the headache is going to be in a band around your head. So it's usually going to present bilaterally. It can go all over your head, but usually you're going to feel this nice tight band in around through here. It's going to feel more pressure, tightening. It can be mild to moderate in intensity. One thing is that it is not going to prohibit your activities of daily living, or it's not going to get exacerbated by routine activities. Usually it will last for about 30 minutes or up to 7 days, depending on the severity of it. For that kind of headache at that time. And usually you're not going to have any nausea or sensitivity to light or sound. Next is the migraine, and it is more common in females by a 3-to-1 ratio. Causes can be a different variety: hormones, dietary sensitivities, caffeine, alcohol, nitrates. It's usually going to present unilaterally compared to the tension type, which was usually both sides. And then it can switch from side to side. So you could have your migraine symptoms on the left side one time, and then the next time it can come to the right. It can switch back and forth, and that's pretty common for a migraine. It's going to be more in your frontotemporal location through here, so in the front side of the head. And it's usually going to feel throbbing, pounding, or pulsating. And it's going to be more intense than a tension type. So it's going to be moderate to severe intensity. And this is where a lot of people will find that they need to go to a dark room to lie down, to stay off their phones or devices, and just have some nice quiet, because it can present with nausea, sensitivity to light and or sound. One thing to take note of is it can also present with or without an aura. So an aura is going to be flashing lights, or you might see spots kind of in your vision, and it happens before you get your headache. So it can be kind of a tell for people that, oh, I'm going to have a migraine soon, because you might get that a day or two in advance. And then usually they'll last about 4 to 72 hours and will be aggravated by routine activities. Third most common type of headache is cervicogenic headaches, and that is going to be caused by neck dysfunction, so either in the joints or in the muscles around the neck that are referring into the head. And it's usually going to be unilateral, and it usually starts at the neck and will kind of come up and around. This one, unlike the migraine, isn't going to switch sides from side to side. It's going to usually stay on one side of the head because you have some sort of dysfunction in a certain area of your neck, so it's not going to switch like the migraine does. It's going to feel more dull, dragging, boring background pain, and then it's going to be triggered by prolonged, awkward positions of the head or the neck, and also aggravated by neck movement. So if you turn your head from side to side, that might cause your headache, or you're like, yeah, that's kind of the familiar pain that you experience. You'll also feel some stiffness and limited neck movement, and might have some abnormal tenderness in the muscles to kind of touch and palpate as well. Milder than a migraine, but can also mimic migraine symptoms. Okay, and then on this diagram here, I just wanted to highlight some other causes of headaches that we also see in the clinic. So the TMJ, so your temporomandibular joint, can also cause headaches from having tight muscles in and around the jaw. That you're going to feel that more on one side, and it's going to be maybe a little bit closer to your actual jaw, to the joint here. Sinus is going to present kind of more in the center of your head, where your sinuses are, and then we already talked about the neck tension and migraine. And one last one is the cluster headache. This is more prominent in males, but you might have like a pain right in, around, and behind your eye. Okay, so some other common causes of headaches: dehydration, caffeine withdrawal, medications, eye strain. So we look at our phones and computers a lot, and that can cause a little bit of wear on the muscles in and around the eye. So there's a muscle underneath the eyebrow that can also refer into a headache as well too. So sometimes having that worked on can be beneficial. An acute infection, and then myofascial pain syndromes from hypertonic neck muscles. So that's a lot of big words right there. So myofascia is muscle, and then also the fascia over top of the muscle. And those muscles in and around the neck, they can become really tight, they can get trigger points, and then that's going to cause a referral into the head. And then, as I mentioned already, the temporomandibular joint, that can also cause a unilateral headache. And you might have pain with chewing or popping with that, and that might help your clinician kind of gear towards that type of headache versus something else. Okay, so here's some common trigger point referrals. So the main culprit is usually going to be your upper trap. So it's going to come out from the side of your shoulder, and it comes all the way along your neck and up to the base of your skull, as well as your suboccipital muscles. So those are the ones at the base of your head, and they can feel really tight or tender. And usually you can kind of know if it's coming from one of these muscles is if you palpate or if you touch that area, you might be able to elicit that headache response that you normally get. Okay, some common headache triggers is lifestyle factors, so stress, lack of sleep, poor work posture. A lot of the times we spend so much of our work hunched over at our desk if we don't have proper ergonomics. So you can imagine how tight all these structures get. And then when we go to open up, you can kind of feel some more tension there. So changing up your posture during your work is really important. Muscle stress, inadequate breathing, repressed emotion, eating processed and sugary foods, that can kind of lead more into the tension type or migraine versus the cervicogenic, and then also just some poor habits as well. Okay, so as far as treatment for headaches, I'm gonna talk about treatment goals. Treatment goals, types of treatment we offer at the clinic here, and then treatment by headache type a little bit more, because it is different depending on what type of primary headache you have. So treatment goals is always to reduce intensity, duration, or frequency of the headache and reduce the use of pain medication. We want to restore normal joint motion and function at the individual joints if necessary, and then make sure we're able to recover full cervical, so neck range of motion, relaxation of the hypertonic muscles, restore proper muscle function and any imbalances, and then improve posture and postural habits as well. So treatment that we do here at the office, chiropractic manipulation of the neck, as well as the thoracic spine and upper back. But again, if you're not comfortable with having your neck adjusted, most clinicians will have alternative strategies to work around that to be able to give you the best care, because again, it's all about what you're most comfortable with treatment as well. Soft tissue treatment, so deep tissue massage, working on those tight muscles and the trigger points, addressing muscle imbalances. So if you have really weak muscles in through the front of the neck, or you're really tight in the back of the neck here, that's going to cause an imbalance. So we want to make sure we can even that out. So strengthening the muscles in the front of the neck, stretching and relaxing the muscles in the back of the neck through here. And then address any postural or habitual issues. So if you're always standing or sitting like this, we want to make sure that you're able to open up, because that's going to cause and make more of those muscle imbalances through there. Okay. Oh, I also wanted to point out that a study in 2022 found that manual therapy in adjunct with exercise had more short-term and long-term effects on cervicogenic headaches than just exercise alone. So whoever you're seeing to have your headaches treated, you want to make sure that they're actually working on the muscles in around that area to help loosen up everything as well too. Okay, so now into some treatment by headaches. So tension type is main thing is me managing stress and making sure you're increasing your water intake. On average, you should be having about 1.5 liters to 2.5 liters of water per day. And it's going to be based on your body type and weight and proportions as well. But that's kind of what you want to aim for. Your 8 ounces or your 8 cups of water usually brings you about to like the 1 liter mark. So you want to strive for a little bit more than that. And then treat the neck if indicated as well. For migraine, it's more important to focus on the big picture. Migraines are caused by more of triggers through, like we talked about, hormones, food sensitivity. So you want to find the driving mechanism. If it's having too much caffeine that causes your headache, or alcohol, or certain types of foods, or if you do have hormone imbalances, you need to address those to be able to help with your migraines as well. Understanding and avoiding the triggers is going to be important. Again, managing stress, lifestyle changes, and then treating the neck if indicated. And then lastly, for the cervicogenic, this is the one that is caused from the actual joints in the neck or the muscle tension and around. So it's going to be most beneficial to treat the joints in the neck and the surrounding tissues. Some additional treatment options that you can do is nutritional supplements. So omega-3s are really good. Melatonin can help with just kind of relaxing the body as well. And feverfew has been known to be helpful with migraines. And then making sure you have good support when you're sleeping. You can buy a specific neck pillow if needed, as well as acupuncture and then massage. We have lots of patients here who have headaches, and they see our massage therapists, and they do wonderful jobs for them as well too. Okay, so I wanted to end the presentation with going through a few exercises that you could do at home, when you're in your car, when you're at work, that kind of thing. Just some basics just to kind of get some activation through appropriate muscles. So the first one is chin retractions. So what you're going to do for this one is we want to focus on strengthening the muscles in our deep neck flexors here. And this is also going to cause a little bit of a stretch through the muscles in the back of the neck, particularly those suboccipital muscles. So to do this, you can do it seated, standing, whatever works best for you. And everyone can try if you'd like as I demonstrate. So you're going to stand, and or you can sit and have fingers on your chin, and you're just going to push your chin back and then coming back to neutral. So you're not coming forward, because that's not what we want. And you're just going to push back. Hold for a second. You should feel some nice double chins being made, and you should almost feel a little bit, if you add enough pressure, that you're almost like closing off your windpipe a little bit, your trachea here. Okay, so here, and you can do 10 of those at a time. I like to do this exercise if I'm at a stoplight in the car, because then it kind of just cues you to do that, and you can use it, and you can have your head against the headrest, and then you can push back with a little bit of resistance there. If you're going to be doing any of these at home, again, always best to be evaluated first to make sure that it's indicated for you. But this is a nice one to try and get the deep neck flexors activated, and again, stretch back through the posterior cervical muscles. Next, we have the low kneeling position here. So it might be hard for me to demonstrate with the camera, unless Michael can help me out here. So actually, Jeff, do you mind being my demo person so I can kind of cue you? That would be really helpful. Perfect. So this is a really good one to work on if you do have difficulty with moving your neck from side to side. So you're going to go into a low kneeling position, and Jeff is just going to load his hands and forearms through the floor. He's keeping his back nice and flat through here, and you want to make sure that you're dropping through your thoracic spine. Good. And you're going to feel some tension through here. So we're trying to wake up our postural muscles in our thoracic spine. So we're working on the head and the neck, as well as getting engagement to stabilize the scapula. And then once you're through here, you want to have these muscles feel nice and relaxed as best as you can. You're tucking that chin, so doing that little chin, and you want to imagine you're lengthening through the top of your chin, almost reaching through the wall before ahead of you. And then from here, you can just do a hold. But what I like to do as well is just have you turn your head to the left a little bit, and then to the right. You're always moving a pain-free range of motion, so finding your threshold here. And this just helps to get those deep neck flexors and the muscles used to moving again, but not against gravity, really, right? So then you're through here. And you just do about 5 to 10 reps aside for 3 sets, and focusing on, good motion, keeping length to the back of the neck, and stabilizing through the scalp. Thank you, Jess. That was great. Okay. And the next one are some stretches. So you can do these ones seated in the chair here. I brought my chair up here to go through as well. So what you're gonna do is you can either sit on one hand, or you can grab underneath the chair if your arm is a little bit longer. And then I'll just sit here because it's gonna be a little bit easier. And the first one we're gonna be doing is for the upper trap. So you're just gonna tilt your head to one side, ear towards your shoulder, but not lifting your shoulder up, so keeping this nice and relaxed. You're gonna place your other hand on the top of your head, and you're just letting gravity, you're not actually pulling, but just letting gravity deepen that stretch a little bit as well. You should be a little stretched there. And you wanna hold it for about 60 seconds each side. So we did that side, and we'll just even it out a little bit, so you'll sit on your other hand, and then you're gonna tilt the head to one side, and then let the hand gently with gravity deepen the stretch a little bit. And it might feel tighter on one side, and that could be because there's more tension in one side of the neck than the other. And then you always want to make sure you do both to even it out. Okay? And then next one is elevator scap stretch. So again, you're sitting on your hand, and now you're going to bring your chin towards your opposite shoulder, opposite armpit, taking the hand on top of the head, and then just letting gravity deepen that stretch a little bit. Holding for 60 seconds, and then switching sides. So we'll switch here, and then chin towards opposite armpit, hand on top of the head, and just pulling, or not pulling, but letting gravity slightly add tension through there, and holding. Great. Okay. And then the next exercise is called Brugger's relief posture. So this is one that I give to many of my patients who have headaches, tighten up muscles in their back and then their neck as well, to use when they're at work. So it's really important when you're at work because you're sitting at your desk, typing like this. We are very much internally rotated in through our upper thorax here. So what we want to do is we want to open up our chest. So you're going to sit at the edge of your seat, feet planted, ankles under your knees, hips at 90 degrees if you can. And then you want to think about having a nice upright chest. You're going to do a little chin tuck, so that little chin retraction we did. Palms are going to be face up. You can do it in the diagram. You can have your arms straight, but I also like to have my palms face up on my legs, and then elbows by my side, and I'm going to turn my arms out. And you might feel tension in through here, in through the chest, or down into the arms. And you're going to hold this position for 20 seconds. And so this is a great thing that you can do at work to break up how you're sitting. I usually tell my patients to set a timer on their phone for 30 minutes to an hour. So every time that timer goes off, you just do this for 20 seconds. And it's just going to help you improve your posture over time. You'll just naturally sit more upright when you're at the workplace, and you'll start to feel less tension through there. Okay, so last thing I wanted to talk about was diaphragmatic breathing. Breathing is so important. We do it daily, as has been mentioned in a few of the other talks earlier today too. But what happens is, as a society, we're kind of taught to suck in and breathing up into our chest. When we do that, we're never actually engaging our diaphragm appropriately. The diaphragm is our main breathing muscle, and it always stays relaxed if we're breathing up into our chest. To contract it properly, we want to breathe down towards our bellies or out into our bellies. And when we breathe up into our chest, what we end up doing is we activate some of our accessory breathing muscles. They're not actually supposed to help with breathing, but they tend to if we breathe into our chest, into our scalenes here, and into our pecs as well. So that can, again, create more tension through here, can lead to more tight muscles in the back of the neck, leading to headaches. And so to engage the diaphragm properly, we want to focus on breathing out 360 degrees and also down towards our pelvis. So we can do this in a seated position here. If you'd like to, you can sit a little bit more at the edge of your chair. You're going to place your hands around your waist, and your thumbs are going to be in the space between your ribs and your hips. So you should feel it kind of in the space where your kidneys might be. And then you're going to rest your other fingers just on your abdomen there. So when you take a nice slow breath in, we want to breathe in slowly, because the quicker we breathe, the more the chance that the breath is going to go into your chest. So you'll breathe in nice and slow for about 3 to 4 seconds, and imagine you're feeling that breath move towards your thumbs and towards your fingers. And then when you breathe out, try and breathe out for about 6 to 8 seconds. And then in again. And then back out. So I usually have my patients start with this lying on the ground with their knees bent and feet on the floor, because you can feel a little bit easier, but it's also a good way that you can check in to see how you're breathing when you're at work. And you can do, usually I'll say 3 sets of 10 breaths, and it's a good way to relax the body, and it provides appropriate stabilization of the spine and the body. And because we're relaxing, taking away some of our stress, and then hopefully that will help manage our headaches a little bit. And that's it. Do you guys have any questions? I'll be around for the next few minutes if you have anything, or if not, it was lovely. Thank you for joining the talk, and then I hope to see you guys in the clinic. Great. Thank you.